What's perimenopause? What's menopause? It's not a recipe.
And it's a whole recipe book. It's called The Zone of Chaos.
Let's talk about the symptom. What besides, irregular periods, what else?
And so for some women, you're just a bit irritable or you don't sleep quite as well. For some women, it can be really significant.
Yeah.
And, that increasing anxiety, the loss of joy, compounded by not being able to sleep, can really make it difficult for those women to continue to work, to parent, to partner, to care.
So many people describe it's like you're not yourself and you don't know how to get back to yourself. It's like you're suddenly somewhere with no map. People are talking about menopause and the stigma. I feel like there was a stigma before, right?
We've never been particularly comfortable with talking about periods, difficulties in pregnancy, so mental health is stigmatized as well.
What's the shift, do you think, that's caused this change of this comfort that we have now in talking about it, so openly?
I think our young people are much more comfortable about talking about
everything, which is good.
There's definitely a lot more people talking there. And if you see that, you go, I'm not the only one. Yeah. So there's a loss of isolation. Often when they're in their perimenopausal years and menopausal years, they're often, leading companies, they're doing great things in the workplace, they're teachers, they're doctors, they're nurses, they're mothers, they're wives. They have real power. Yes. And actually, I think women are coming into that power. These women recognize that it's important to lead by example and, to be open about.
For women who are feeling so uncertain in their body, what kind of advice would you give them?
I would always say sleeping is the laziest way to stay healthy and slim. So, start with something really small. A couple of deep breaths. Yep. Doesn't have to be a whole yoga session. Just listen to what your body's saying. And if it's saying you're trying to do too much, then just maybe take a breath. And if you think it is a hormonal problem, it probably is. Become educated so that you can become an advocate for yourself.
Welcome to SWIISH Wellness Unlocked, the podcast that cuts through the noise and gets straight to what works. We're your hosts, Sally Obermeder
and Maha Corbett.
We're founders of a global wellness brand that's been changing lives for over a decade. Every episode, we're going to explore the latest trends. We'll dive into breakthrough science and insights from leading experts to help you live, feel, and look your best. No fluff, just facts that work. Let's unlock it.
All right, let's start. Let's kind of get the definitions out of the way first. So what is technically, just so there's no gray area, what's perimenopause, what's menopause?
Okay, so perimenopause is definitely the grey area.
Yeah.
So starting with the black and white, menopause is the single day that is 12 months after your last menstrual period. Mm-hmm. So that's for women who go through a natural menopause, so when menopause should have happened.
Yep.
There are obviously women who go through a surgical menopause, so that's when your ovaries are removed, and that can happen for a variety of different reasons, such as endometriosis or as a preventative surgery if you carry a high-risk gene. Yep. And then there's medical menopause. So women who go on to medication, including chemotherapy, will also often be put into a medical menopause. So the ovaries stop working because of the drugs. Yep. So that menopause day is really just one day. And the time up until menopause, when you're having symptoms, which can be anything, because you've got estrogen receptors in every single cell of your body, can go on for 7 to 10 years, which is, this, and it's called the zone of chaos. So
isn't that a good term?
So I think it's a really good description because you're not ovulating every month and your egg quality is not as good. So you get these huge highs of estrogen, you can get quite marked lows, and also your progesterone doesn't always kick in each month when you don't ovulate. So progesterone levels are often a bit lower. And it's another really important hormone, especially for mood and sleep. And testosterone is our third sex hormone, which isn't related particularly to menopause. It sort of falls across the life cycle. We think in women that testosterone probably peaks in your late teens, 20s, and then it gradually falls decade on decade. So for some women, that might have fallen more than others. And I do wonder, the people that kind of get through menopause and say, I have no symptoms, I always wonder, have you got good testosterone levels? What's getting you through? Why
do you sail through?
Why has it been? And these are the women I think we should really study, these women that sail through perimenopause and menopause and feel great. So menopause is just one day. After that day, technically you're postmenopausal. People talk about getting through menopause, but actually when you are postmenopausal, if you are not on any hormone replacement therapy, your estrogen, particularly your estradiol and your progesterone, are almost zero. So you can't detect them in the blood. So that is how you are for the rest of your life.
For the rest. Okay, so let's talk about maybe just the shift, before we get into symptoms, everything, the shift in just the climate that now people are talking about menopause and the stigma. I feel like there was a stigma before, right?
Yeah, I think so much in women's health is stigmatized. So we've never been particularly comfortable with talking about periods, difficulties in pregnancy. So mental health is stigmatized as well. And certainly menopause, because it is associated with the end of fertility, and there's a huge value placed on fertility in women in multiple cultures, but or perhaps in the majority of cultures. So that loss of fertility and that loss of youth, I think, has carried stigma with it. Obviously, we know now that women, often when they're in their perimenopausal years or menopausal years, they're often, leading companies, they're doing great things in the workplace. They're teachers, they're doctors, they're nurses, they're mothers, their wives. They have real power. Yes. And actually, I think women are coming into that power. So we're now recognizing that maybe menopause is not the end, it's a transition stage.
What's the shift, do you think, that's caused like this change of this comfort that we have now in talking about it, so openly?
I think it's happening in different age groups. I think our young people are much more comfortable about talking about everything,
which is good.
Yeah, from periods to sex to consent, so we've got this openness. So I think there's certainly a drive there. I do wonder whether social media has allowed people to talk about things in a space where they're not necessarily putting their face to their words, so they can say things. So there's definitely a lot more people talking there. And if you see that, you go, I'm not the only one. Yeah. So there's a loss of isolation. But I also think there's been probably a socioeconomic shift in that we have more women who are in leadership positions. We've got more women in government. We've got more women, higher up the food chain in the corporate world. Yeah. We have more women who are leaders in medicine, for instance. So I think these women recognize that it's important to lead by example and, to be open about
driving the charge and talking about it. Yeah. Let's talk about the symptoms. You talked about it as this period of chaos, which I think is so like one of probably the best descriptions I think I've heard. Let's talk about the symptoms. What besides, irregular periods, what else?
So really having to go back to every single cell has got estrogen receptors on it. So our little mitochondria, our battery packs, are covered in estrogen receptors. So when the estrogen and possibly progesterone and testosterone, we don't know quite as much about them, but when they fall, our battery packs sort of are on half charge. And what we recognize now is that probably about 80% of women will get psychological symptoms in perimenopause and menopause. And that's a huge number. So
massive.
And so for some women, you're just a bit irritable, or you don't sleep quite as well.
Yes.
And, and as women do, and we talked about this earlier, we often just suck it up.
Yes.
But for some women, it can be really significant.
Yeah.
And, that increasing anxiety, the loss of joy, compounded by not being able to sleep, can really make it difficult for those women to continue to work, to parent, to partner, to care, all of the things that women do. And, unfortunately, we do know that in that age group, there is a really high risk of suicide for women. At times. It's the highest risk time. So it can be at times it can be fatal. So psychological symptoms are the thing for my patients that upset them the most.
Yeah. Is it also that you feel like, I've heard so many people describe like, it's like you're not yourself and you don't know how to get back to yourself. It's like you're suddenly somewhere with no map.
Yeah, absolutely. So, and I think that's because these hormones are really important in our brain. So they control how our neurotransmitters are produced. So they affect our dopamine levels, our serotonin levels, our GABA levels, our glutamate levels, et cetera, et cetera. So they really determine how we think, how we feel, and how we behave. So when those levels are fluctuating wildly, our brain doesn't cope very well. So you're and if you think how you are and how you feel in yourself, it's entirely related to what is going on neurologically.
Yeah.
So when that shift happens, there is absolutely a dissociation almost of who you were and who you're feeling now. So it is dramatic.
Are there any like lesser known symptoms, the things that maybe people might not attribute to Peri that like actually are part of it?
Yeah, I mean, as I said, you can choose so many weird and wonderful symptoms. Some of the good ones are like insects crawling on your skin, which is called formication, which is you get formication instead of fornication.
How sad.
It's quite depressing. A lot of women do get tinnitus, so they get ringing or buzzing in the ears. So we know that increases with menopause, and that might be a neurological thing, or it might be actually a change in the bones in the ear. A lot of women get TMJ pain. So and that can be really distressing and can often be associated with teeth grinding and can change your sleep. A lot of women do have sleep changes, not just that they're anxious and can't sleep, but women start to snore and can develop sleep apnea. Burning hands, burning feet, burning mouth. Yeah, so a lot of, and gut changes. So really anything, the things that bother people most are the psychological symptoms and then the neurological, the brain fog, the feeling of thinking and treacle and not being able to find words.
And you're right, like the mental, the brain fog, and also the emotional, right? Like that, like perimenopause or menopausal rage, like that feeling of like you're so furious with everybody all the time.
Yeah, I actually think that could be used as the diagnostic sign. So if your partner's breathing or the sound of them eating makes you want to kill them.
With a dirty fork.
Or a bent spoon. It's so real. I told my husband about this the other week, and he was so hurt. And I went, no, it's not just you.
Yeah, there are other people I want to do this to as well.
No. For me, it is just him.
Well, right.
There are a lot of other women who feel about their husbands. And I don't know if it's just in heterosexual relationships or if it's just as bad with any partner. But I said, no, it's okay. This is definitely me, not you. I don't think your eating is noisier.
What is that? Why, what's going on for us inside where the partner that we've been with for all this time, whose breathing has never bothered us, that as we enter this shift, suddenly they're mere, you just want
presence.
Yeah. Yes.
Yeah. And it is dangerous. So I think it's definitely going to be those shifts in the brain again. So we lose a bit of our oxytocin, so our bonding hormone. So I think there's probably a bit of a shift where, there is an issue in your intimate relationships where that becomes a bit disjointed, but your irritability and your tolerance really plummets.
Yeah.
So your irritability is high, your tolerance is low. So small things that didn't used to annoy you
suddenly do.
But I think there's something going on with the oxytocin there that really makes the breathing and the eating become unbearable.
Let's talk about night sweats, hot flushes. That's obviously one of the most common things that women talk about that really, I think, is very, so much of it's disruptive, but that's one of the big ones that women talk about. What's going on there?
So your thermostat in your brain is covered in estrogen receptors again. And when those levels start to change, your body isn't able to regulate its reaction to temperature. So when there's a very small change in ambient temperature, that thermostat thinks that, you've just gone into the Sahara. So it's making you sweat. It's trying to cool you down when there really isn't any environmental temperature change. So and that thermostat change is very distressing for people. Most women, it is not actually the most distressing symptom. They can kind of work around it, but it is the most common and the most well known.
The most distressing is obviously coming back to the emotional, right? Let's talk about, what is it that women can do, to support themselves? Aside from, we'll come to HRT, any of that kind of stuff separately, but just in terms of their day-to-day life and living, what can they do?
So I think always sort of knowledge is always power.
Yes.
So I think that, we should be educating our young people of both sexes from an early age to understand how hormones do impact your brain and your body, because our young people don't understand much more than, getting pregnant, not getting pregnant, and not getting an STD.
Yes.
And it's so much more than that. It's really looking at mental health right across the life cycle. So number one is becoming informed and educated the way you do about things that are important. And this is really important.
Yeah.
And then it's the same principles that you apply to all aspects of health. So our body likes routine. likes the same stuff. So really important to get up at the same time every day, to get that morning daylight exposure. Maybe try and calm your nervous system down a little bit with a couple of deep breaths. Doesn't have to be a whole yoga session. Just 2 minutes of breathing outside your front door,
Keep
on your
the
deck.
cortisol low.
Yes, and getting that sunlight. And these are such basic principles, but they're hugely important. And
funnily enough, they can be hard to do, right? Because we're not coming back to being programmed. We're programmed to, to some extent, open our eyes. Many of us will reach for our phone, followed then rapidly by caffeine. So it's like it's all a lot of cortisol on top of, it's like a lot.
Yeah, I think I don't know because people haven't studied it, but is menopause and perimenopause experience worse because of our environment? I suspect it probably is, because we live in this world of dopamine depleters and, sleep deprivation. So I think always winding that back and thinking like, how would I be living if I was on a farm? I'd be getting up early with the sunrise. I'd be going outside, be doing some exercise, to gather the sheep in or whatever. But, just those basic things and eating well and your nutrition. So not drinking alcohol, hanging out with people you like.
Anything specific around diet? Anything specific that you think, women should be having more of or less of?
So absolutely, I think it's really important that we focus on protein and fiber. And, that's the call. And how much protein should you eat? And somebody said, well, just find the largest number on Instagram and subtract 10. And so I think, I think it is worthwhile thinking about your meals being protein and fiber, and your fiber is your carbohydrate. So you're having those, your vegetables are your carbohydrate. Your carbohydrate doesn't need to come as a white roll on the side. So good lean. I don't have any sort of opinion on whether you should be vegetarian or not. I think what works for you around your personal belief structure, but definitely having good quality protein and plenty of healthy veg. That's somebody gave me the word today, the JERF diet, just eat real food. I hadn't heard that before.
It's good, isn't it?
It's not rocket science.
Yeah, it's true. Try and come off the processed and just try and eat. Yeah, exactly. And also don't starve yourself and don't, don't try not to overeat, try not to undereat. And sometimes I feel like there's so much noise around food, particularly if you open socials, you will be flooded, or you could be, depending obviously on your algorithm, you'll be flooded with like what everyone's eating, what I eat, a day and a plate, da, da, da. And so then you can become so in your desire to do better or do right by yourself, be so overwhelmed.
Yeah, and then, you're paralyzed by that.
Then you do nothing. You reach for a bag of chips while you're scrolling to work out what to eat, because it's so full on.
Yeah, keep it simple. And you can eat the same thing every day, have your avocado or your eggs for breakfast, some high protein yogurt, a frittata or a salad with some chicken in it for lunch, or a tin of tuna. Just keep the cupboard full of tins of tuna. Try not to worry too much about the mercury. And then, your dinner's just your old retro dinner. It's, meat or
free veg.
Yeah, and try not to eat too late. People talk about time restricted eating and intermittent fasting. I think try not to eat too late. Eat when the sun's up, and sleep when it's dark.
Which is, I think, very sensible. I think a lot of the, there's a tie-in, I think, with the food, and particularly I think around peri and meno, women always talk about like the midsection, and they feel like their body's gotten soft and, they're losing muscle. And so there's this desire to obviously manage that. Suggestions?
Yeah. So again, the same things I've just said are really important for your metabolism. So I would always say sleeping is the laziest way to stay healthy and slim. So you cannot cheat lack of sleep. It's so important for your body to regulate its metabolism, and it's so important for your brain. But strength training. So I don't go to the gym. I'm a full-time doctor. I have a second business. I have 3 kids. So I have my chin-up bar hung up on my bedroom door, and I've got some free weights at home, and I do half an hour every morning. Some days I go for a run. Other days I just do free weights, and it's 30 minutes and it's done in the morning. And it doesn't need to be a lot. I think the gym's great, and I think you can do a lot more. I could do a lot more, but as long as you're doing something, and not feeling overwhelmed. The heaviest weight in the gym is the door. So, start with something really small.
So the gym is the door.
So start with small stuff.
Yes.
Hold up, try and do some press ups on your knees at home. Do 5, do 2.
Yeah.
Just start really.
Just start. Yeah. You said something really interesting to me before when we were talking about the spine. Can we just cover that again? I thought that was fascinating because I didn't actually know that that's what happened as a result of menopause.
Yeah. So I look after women, as I said, from babies until the grave. So I have a lot of older women who have osteoporotic spines, and that means they've lost that lovely straight vertebral column. So I sit up straight, and so they've become hunched over, and that's because of different things. But mainly the vertebrae themselves have started to crush. The discs in between the vertebrae have started to lose height as well. So that softer material has also been lost. And then the muscles around it have also weakened. So women, much more than men, have osteoporosis. About twice as many women compared to men have osteoporosis, and twice as many women will have an osteoporotic fracture. And what happens is that the bone is covered in estrogen, progesterone, testosterone receptors, but particularly estrogen. And when women are going into the last few years before menopause, so in late perimenopause, they're starting to lose bone at quite a fast rate. So we build bone up from our teens up until sort of our late 20s. So we put down our peak bone mass in our early life, which is why osteoporosis is actually a disease of childhood that only presents in older adults. So it's so important that we're investing in our bone health from the get-go. Yes. So in your teens, girls should be weightlifting then as well. And then, so in those last few years before your last period, which you'll only know in retrospect, you're starting to lose bone, perhaps even up as fast as 5% per year. Which is a lot.
That's a lot.
So fast losers, so women who are slim or who have a genetic risk of osteoporosis, or who might have other diseases such as rheumatoid arthritis or celiac disease, can lose their bone much more quickly and can lose 25 to 30% of their bone in the 5 years around menopause.
So to help support, to prevent it, to slow that down, weight training, calcium, vitamin D, K2, that combo.
Actually, probably the big thing again is protein. And probably fiber, because protein is, I would say, is what you're putting into your body what you need to build stuff, whether that's bone tissue, heart muscle, brain tissue. And then the fiber, I always think, is like clearing out the trash. It's, clearing out the rusty bits. It's keeping the cells really functioning at a healthy, younger level. So protein, I think fiber is important as well. Vitamin D, keeping your vitamin D levels up, and K2 obviously then means you absorb your vitamin D a bit better. And your strength training, but also healthy fats. There's a lot of fat in bone. So your avocado, your olive oil.
Keep that up every day.
So eat real
critical.
Food.
Let's talk about options for women. HRT, such a big one. And I just want to be clear, this is not medical advice. It's like we're just talking like generally. Let's talk pros and cons, because I feel like HRT is one of those ones that's so divisive. I think people are very pro or they're very against. In the middle are a lot of people who are just confused because there's so much noise both ways. Can you, maybe let's just do pros and cons, if there is,
Yeah, so HRT, what we're talking about when we use those letters, or MHT is the other way it's described, it usually involves estrogen and progesterone. So, and what we're trying to do in perimenopause is to stop those extreme fluctuations. So trying to get that nice steady state so that there's not these terrible lows really, which can really impact that mental health and also your bone density. So trying to keep your levels up a bit. So we're not trying to keep you super high. We're trying to stop those lows, and testosterone can have a role as well. After menopause, obviously your baseline levels are gone pretty much. So you're just trying to top it up a little bit. So if you think like the average estrogen level probably in a woman that's having periods is around about 400 or 500. So you're trying to bring it up to maybe about 200 or something like that. And the pros of HRT are really that it is the gold standard, most effective treatment for the symptoms of perimenopause and menopause, but it also reduces the risk of future disease. So it dramatically reduces your risk of osteoporosis and osteoporotic fracture by somewhere around 30 to 50%, reduces your risk of heart disease, and there's some evidence that it reduces the risk of dementia, which obviously a lot more women have dementia than men, again, we think because of menopause. So it is regarded as safe and effective for the majority of women. And the hormones that we use, or we should use now, should be body identical. which means they're chemically and structurally identical to the hormones that your body produces.
Makes anyway.
Yes. So we're kind of replacing like with like. So we're trying to treat the problem at source as opposed to using multiple different drugs for the symptoms that are downstream.
Yes.
And the safest way to get your estrogen is as a patch, if you can get it, or a gel, although you can also use a tablet. And the reason we like to use it through the skin, which is called transdermal, is because it doesn't go through the liver, so it doesn't have any risk of blood clot, like a deep vein thrombosis or a pulmonary embolism. It doesn't increase your risk of heart disease. And that, in fact, actually reduces it. And progesterone comes as a little capsule. And then testosterone, if you're on that, comes as a cream. And the cons really are that they're small in general. So if we look at side effects, and that's something that people feel that we don't talk enough about.
Yes.
So some women do struggle when they start HRT, and they
In which way?
So breast tenderness, so you can feel your breasts get a bit fuller. You can get a bit of irregular bleeding. If you're postmenopausal, you may even start to get periods again, which can be quite unnerving and should always be investigated. Some women feel they just get a bit bloated because your gut can change a bit and there can be a bit of fluid retention while you're settling in. But most of those symptoms will settle within 3 months or so. So it can mean you need to tweak the doses and maybe go a bit slower, but most women will settle with that.
Yeah.
But the big thing is the concern about breast cancer.
That's the big one. That's the big one that people, I think, are worried about. Any thoughts?
Yeah. So what we know from the data overall is that body identical hormone replacement therapy does not seem to be associated with an increased risk of breast cancer.
Yeah.
And we've got data for about 10 years on the progesterone. We've got really good long-term data over decades looking at estrogen on its own, that estrogen does not increase the risk of breast cancer.
So where did this come from? Where did this
This fear.
This talk, it is a very genuine
It's
fear.
huge. It is the elephant in the room, you know, so, and it is women's biggest fear.
100%.
So in the late 90s, because they recognised that we hadn't really done much research in women at all, they decided to do a trial to see if hormone replacement therapy would reduce the risk of heart disease in older women. So they had quite a lot of data in the 90s that showed it did reduce the risk in younger women, but they wanted to do a really good trial, very expensive trial, billions of dollars. And they used to meet every few months and discuss their findings. I think it was, by all intents and purposes, quite a boring regular meeting. And then suddenly in 2002, a small group of the researchers announced that they had found an increased risk of breast cancer in the women who were on both estrogen and progestin. Now, the hormones used in that study were old, so it was the horse's estrogen, horse's wee estrogen, and a synthetic progestin called medroxyprogesterone, which we rarely use. And they saw a signal of an increased risk of breast cancer. When they showed those figures to the majority of the researchers who were involved, when they recalculated it, the risk wasn't even significant.
Right.
But they had already put the story into the Journal of American Medicine. It was already, the world's media was already primed. So if it wasn't about women's health, it would be the biggest scandal. It would make a great movie in my menopausal mind. But somebody decided to find something wrong with the HRT and they got it into a journal, a medical journal, and it went viral overnight. And they never came back to say, actually, we've re-looked at the figures and that wasn't statistically significant. Now, long-term follow-up of the WHI, which was the study that showed the breast cancer risk, showed that the women who were on that estrogen and progestin, they did have a small increased risk of breast cancer, very small and much smaller than they originally reported, but they didn't have an increased risk of death from breast cancer, which is really interesting. And they got breast cancer.
They got it, but they
recovered. They survived.
They recovered. Only because it was detected early?
So there's a suggestion maybe that these synthetic progestins are promoters of a breast cancer. So if you've got a breast cancer sitting there, it will make it grow.
Yep.
and it might appear more quickly than it would have otherwise. So this idea, you know, a lot of women who are on HRT will get breast cancer because the biggest risk factors for breast cancer are being female, which sounds very obvious, but it's important to realize. And it's only really women who take HRT. So it is women who are women who are taking HRT will get breast cancer, but does that mean that the HRT caused it? So, and I think that's really hard. So, and the other big risk factor for breast cancer is increasing age. So, you know, you're moving into your 40s, your 50s, your 60s, your breast cancer risk is increasing with each of the
you're saying almost just being a woman and getting older is already an increased risk for breast cancer. And then you've got this other element which may or may not,
and then you take HRT. And so most women will know of somebody who started HRT and got breast cancer 3 months later. But what I was never taught, and I think is a really important fact for women to know, is that breast cancer takes about 7 years to develop from a single cell. So this concept of my friend or my neighbor or such and such's friend got breast cancer, that breast cancer started years ago. And it would have appeared at some point anyway, whether the HRT made it appear a bit more quickly. And we have quite a lot of studies. There's about 24 studies looking at women who have a history of breast cancer who take HRT, and all of those studies have shown no increased risk, and some have shown a decreased risk of recurrence, and only one has shown an increased risk. So there's so much we need to really learn and research about women who have a history of breast cancer and HRT, because at the minute we've just parked that population of women. You know, there's a couple of studies happening in the US, but really we've kind of entangled estrogen and breast cancer incorrectly. And we've also abandoned a huge population of women who deserve to have more information about the safety of HRT when they have a history of breast cancer.
Look, I know I've avoided it because I was like, well, I've had cancer and I just survived. I just don't want to. You know, it's so tricky because the same, that's that, like you've heard a headline and you just don't want to, you're just like, I'd rather white knuckle it through this entire thing than have to, I did my chemo and radiation and surgeries and stuff. And I'm like, oh dear God, I can't go there again. You couldn't do it again. I can't do that again. And I think, if you've had the stage 3, so it was like, I'm only here by the good grace of the universe. I'm like, I dare not tempt fate, but it does mean then that menopausal wind that I had what you described as that medically, because I was having chemo. What did you call it? Not medical menopause. Yeah. And it was horrific. But I was like, well, better this than the other option. So best I just pipe down and just keep going, And
I don't think that's fair. So, and I'm not saying we have enough data to say that HRT after breast cancer is safe, but equally, I don't think we have enough data to say it's not safe. Yeah. And, for 51% of the population, where a significant percentage, unfortunately, will get breast cancer, and breast cancer is probably going to be on the increase, as we talked about. A lot of cancers are on the increase because of changes in diet and environment. Then we really should, those women, including yourself, deserve to have access to information. Yeah. And there are women who do choose to go on to hormone replacement therapy, as I'm sure you know, after breast cancer with that knowledge. And it's a very personal decision.
Of course.
But it should be the decision that you get to make, not that I get to make for you.
That's right. It's important to have the information and then choose either way, knowing that 100%. What else then besides HRT? What are some other things? We've talked obviously a little bit about diet, we've talked about exercise. What about emotional support?
Yeah, so when you're in a low estrogen state, a lot of trauma can come back to the fore. So women who've kind of managed for different reasons, and then they're moving into this life stage, and I think it's psychological and social as well as biological, but previous traumas or difficulties can often come to the surface. So it might be you're having a bit of a crisis about where you are at in your relationship or in your job or other things. And I refer, a lot of my patients will see a psychologist, to maybe unpack some childhood trauma or trauma from a previous relationship. And I think it's a really good time to do it, because then you can choose to go into your next phase, feeling good about yourself, being able to put up a new set of rules, creating some boundaries, you know, maybe cutting back on the people pleasing, you know, putting yourself first. And I think that's one of the brilliant things about menopause is you start to go, hang on a second. Like, I matter too, you know. Let me look after me.
Yes, me too. I always say me too. It's like me too, me as well. You know, like instead of just everybody else first, it's also like, you know, I don't need to be. I'm not saying I've got to go first, but I've got to go as well.
Yeah,
you know.
Yeah, I think women, you know, we are terrible martyrs, you know, putting, you know, carrying the weight of the world of our shoulders. And if we do want to carry that weight, then we need to be strong.
Yeah,
and that means investing in ourselves.
And supported. What about people with their partners, like support around like relationships, or what can they tell their partners? And because I think it's also very tricky for partners who are also in the dark. Like, we're in the dark. Imagine how in the dark they are. What can, you know, people say to their partners and share? Besides, obviously, communication is important, but
yeah, I think trying to speak about it in times where you're not feeling murderous rage is probably
Step
better.
one.
Yeah, so choose your time. And, you know, and making time for that relationship, because this is often a really busy time in people's lives between work and kids, whatever age they are, or caring for older parents. And so your partner often gets, you know, abandoned. You know, you might have a more important partner. Your business partner in your life might get more of your time than your romantic partner. So, you know, putting time aside, you know, having, like, thinking of your marriage or your relationship like a business that needs time investment as much as any of the other relationships or businesses in your life. And, you know, having that date night, going out for a meal, you know, time where you're going to spend together, you know, connect. Don't just sit and, you know, on your phones pretending to watch TV, which I'm definitely guilty of, you know, sitting going, right, must do better as I say these things. But, you know,
note to self.
Definite notes to self. You know, I always say that to patients, like, listen, do what I say, definitely don't do what I do. Maybe the chin-ups. But so that's so important. So time and, you know, and touch, like we're humans, but we are animals and we really respond to touch. So just like having a hug or holding hands or sitting beside each other, like, you know, there's so much more than verbal. We're actually probably more non-verbal than verbal. So those really basic things, you know, going for a walk on the beach, sitting together, you know, we live in a wonderful country where there's lots of beautiful places to be. But then it is important to talk. But sometimes it can be useful for a partner to hear some of the information about perimenopause and menopause from somebody else. Louise Newson did a fabulous podcast 2 years ago with the Imperfects. And I know a lot of men have found that a really accessible podcast because it's men asking a woman about it, and it's a safe space. And I know a lot of patients have found that extremely helpful. And then, you know, there's other doctors who've spoken on other podcasts with men where they've really felt it's opened their eyes, because it's like, And for male partners, you know, just giving your partner time and space, you know, if she's raging, you know, just understand that this is not necessarily a reflection of you.
It's not about you.
You probably should have taken the washing out of the machine, and you probably should have had the dinner ready. But, you know, maybe just give her a hug. Because again, you know, it's really hard to be angry when you're hugging. Like, the hug is underused.
That's so true, isn't it?
Yeah, you know, we're basic creatures.
For women who are feeling so uncertain in their bodies, and like when you're in the thick of it and you don't know what's coming, what kind of advice would you give them?
So lean in, you know, very popular phrase, but, you know, just listen to what your body's saying, you know, and believe it, you know, and if it's saying you're trying to do too much, then just maybe take a breath, turn off your phone. I think, you know, we're very time poor, definitely in part because of the amount of technology that's in our lives. So try and cull some of the things that don't add value to your life. So, and then that will probably allow you to have a little bit of headspace to calibrate and to take stock and recognize what is going on. And if you think it is a hormonal problem, it probably is. I mean, we are intuitive, and be confident in that. Do some research, you know, become educated so that you can become an advocate for yourself. It's likely that you have friends who are going through the same things. So women, one of our strengths is that we can talk and support each other. You know, so sharing that information and hearing other people's stories is really validating. And if you want to go and seek help, then do.
How important is it, do you think, for women to have a like a regular doctor, like somebody, rather than just say, I might self-diagnose, I feel a bit of this, let me research that, but actually having somebody who's on the path with them?
I think it's, I love my job because that's what it is.
Yeah.
I know my patients well. I know their families. So I appreciate that I'm in a really privileged position. And I always say it's the Carlsberg of general practice because I have time and I know the families and I work in a kind of village atmosphere. But somebody that knows you, that recognizes when you're not yourself, who you can say, that doesn't work for me, or I don't like that. That's really important. Yeah. The doctor-patient relationship, like most relationships, should be a partnership. Yes. That you're walking this healthcare journey together. It's not me telling you what I think you should do.
Yes.
Although it is a bit of that, but it's you saying, well, that isn't going to work for me. So can you give me other options?
And what about people who feel overwhelmed with what they're seeing on socials? They're trying to do the right thing. They're, look, I feel this, so let me do a quick search on this, that, the other. Tips,
I think pull it back. I think definitely the social media, while it does provide a lot of information and it has democratized a lot of knowledge that normally would have been hidden behind paywalls, it definitely can become overwhelming. So choose how much time you spend a week and try and be strict with that. Yes. I think old-fashioned ways of getting information, like a book, where you can read it and digest it slowly.
Yes.
It's not. Yes. Life is kind of nuanced and complicated, and getting it in bite-sized reels is not necessarily the best way for you to fully understand things.
Yes, especially something complicated like this, right?
Yeah. This is major. This is
it's not a recipe, right?
No, it's a whole. I mean, and it's a whole recipe book.
Yes.
So you can't this is a cordon bleu meal.
Yeah,
that's going to take a lot of pages of reading. So finding information in a way that you do like to digest it. Other people like podcasts, other people like to talk. We think our platform is brilliant with healthy hormones because it's not, we haven't used any behavioral technology to try and make you doom scroll in it. You can go in and you can leave. You can ask a question. We've got a very limited amount of curated resources there for you to look. You'd get bored if you spent too much time in there. So finding a reliable platform where the information is limited but is evidence-based, I think is a great idea.
Very important. Yep.
And we have a community, again, which is so important, I think, in most aspects of humanity, but particularly in health. So you can hear other people who are walking that walk with you, and then you can leave again. Yeah.
Before I let you go, can you, for somebody who's in this, the podcast is Wellness Unlocked, and I always like people to walk away and go, okay, if I wanted to, I hear you, I take this on board, there's something I want to start now, today, tomorrow. What is it that people could do to slightly start to unlock some relief for themselves?
So I think educate yourself. So definitely go read the books, listen to the podcasts, limited social media exposure. Number one. Number two, start to keep a track of your symptoms. There's some really good apps out there. Certainly the Balance app from the UK is great. It can generate you a health report. So you can start to see where your symptoms are. Are they varying throughout the cycle? That can be really validating. And then I think do go and see a trusted health professional. Find yourself a GP who you can connect with. And if it's not successful on the first go, ask for a second opinion, ask if there's somebody else, and always consider bringing a friend, sister, partner. Because as doctors, we're terrified. I always say this, terrified of two people coming in.
Really?
Yes, because the power dynamic totally changes. So you can bring your bestie or whoever it is, and they will advice. They will speak up for you when you feel voiceless.
Yes, that's such. And you know what I think is actually is so good about what you just said is that how often you'll have told your partner or your best friend, like, I feel all these things, and then you get in there with the doctor and you only say half of them. And having been to many appointments, I know, say with Marcus, he'll be like, no, but remember, tell her how you said that thing. And remember when you told me this? And then you're like, oh, yes, I also, blah, blah, blah. So you're right.
You see how I just, there's a terrible power dynamic between doctor and patient. It's so unhealthy.
Oh,
you bring in the big guns, whoever that is, just your friend.
Bring your bestie.
And suddenly we're like, you've changed it all.
That's such great. And also sometimes I do think you can feel a little speaking to myself, sometimes overwhelmed, sometimes also conscious that, coming back to the power timing, the doctor's time is so important. And if you've taken 5 or 10 minutes, I don't want to take any more. So then I feel the need to like bank this for another time and I don't want to bother you too much. That's a great tip.
Yes. And don't say sorry to bother you, because that's like, you know, when somebody says that, you're like, okay, I'm sitting back. Yeah. There's some big stuff coming.
Clean my diary. Thank you. That was unreal.
Well, that's a wrap on Wellness Unlocked. If it hit home, then hit follow, share it, and dive into the show notes for all of the links and any of the resources. Head to swiish.com for more. And if you're in Australia, you can also find us in Priceline stores. Now, we want to hear from you what resonated, what you want more of, and what you're curious about next. This is your space for wellness that works.
Remember, everything we cover is for general informational purposes only and is not a substitute for medical advice. Always consult your healthcare professional before making any changes to your health or wellness routine.